Let me immerse you into a world where the tools that save life don't only save life, but don't cost the earth as well, right? So we are going to immerse ourselves today in a world where we are going to talk about innovation and sustainability at the intersection, and I'm going to talk about in the realms of medical devices. So traditionally, if you see most medical devices today in the world have an element of plastics, an element in the manufacturing process which increase the carbon emission. However, if you would see, precisely, innovation can also be our ally. And that is where I am going to unveil how innovation can be an ally in the healthcare industry and how sustainability has a huge element to play from a healthcare perspective and how healthcare can transform the future of sustainability. So let me first start off with some of the guiding principles of innovation, right? So let me talk to you about what is innovation, right? So innovation is the creation of a new viable offering. When I say viable, it talks about creating value to the customer. It's not only the customer, it's the brand, it's the platform, it goes beyond it, right? And if you see this graph, right, most people think in theory that innovation is in a straight line, right? That innovation is just a straight line for most companies. However, if we would see, so there are ups, there are times, as you can see, where vision emerges and there is disbelief in the center. There are teams which think, it's not working around, and there is a passionate debate towards the end of continuing in the process, right? So this ups and downs in the innovation process is very, very peculiar, right? And it takes a lot of time for most companies to come up with an innovation which is valuable for the customer. Now let me talk to you about a few innovations today. And the first one is biodegradable medical devices. I'm very sure you must have started hearing about biodegradable medical devices. Imagine a picture, just imagine a picture where a medical device disappears after doing its work. It disappears after doing its work. That's exactly what I'm talking about. It's not a utopia, it's existing today. Such a medical device is existing today. And I'm going to talk to you about a stent. A stent which can disappear after doing its work. Very similar to a metal stent, very, very close to a metal stent, but it disappears because of the polymer and the material of the stent is biodegradable, right? What does it do? The patient doesn't have to go another surgery. The patient doesn't have to go another surgery, right? He's much more protected. And hence, it is more environment friendly. And that is where such technologies are going beyond the realms of medical, beyond the realms of the medical history, right? Such technologies are creating more sustainable infrastructure, not only for hospitals, for patients as well. Okay, let me now talk to you about the second innovation in healthcare, which is going to be more sustainable in the near future. This is about 3D printing. 3D printing is all about design and manufacturing. Very, very specific design and manufacturing in the industry. It is customizable to the patient. It can be got to the patient right at their houses. So, less amount of waste. Less amount of waste because it's coming directly to your houses. Less amount of energy right to your houses. A good example today is prosthetics. The prosthetics can be got directly at the house, right? Customizable to the patient. So that's how the industry is changing. That's how healthcare is changing. Healthcare is contributing itself to sustainability at large. Okay, so let's shift ourselves to the third innovation. The third innovation is about AI-powered medical devices. I'm very excited to talk to you about AI-powered medical devices and how medical devices are actually changing. from a surgery perspective. Now, I will take you to the world where there was open heart surgeries, where there were open surgeries, where there were a lot of blood. Today, believe me, today we are going to have surgeries through robots. So we are going to have surgeries through robots, and robots are going to do surgeries. And the surgeon is going to operate from a different location. So surgeon is trained to operate on the patient at a distance using these robots. These robots are so accurate. These robots are so accurate, they can actually do the surgery with the same kind of precision again and again. So they are augmenting the skills of the surgeon. They are augmenting the skills of the surgeon at large. The surgeons will remain, but they are augmenting the skills of the surgeon. That's the future, right? So what we are doing is reducing footprint, right? Reducing footprint. A lot of energy inside the operation theater is going down, right? You're minimizing the amount of workflow inside the operating area. Okay, so AI is the fourth industrial revolution, as you all know, and AI has a huge use case across the industry as well as in the operation theater. And you would see a lot of medical devices, AI medical devices, who will talk inside the operation theater in the near future. Okay, let me talk to you about the next innovation, which is telemedicine. And I'm very sure you must have heard about telemedicine and remote monitoring quite a bit. So this emerged beautifully at the time of pandemic, when we had COVID in India, and there were patients who could not go to the hospital. That is where it all emerged. And today, telemedicine forms close to 20% of the revenue of most of the hospitals in India. 20% of the revenue, which was not even 2 to 3% earlier before pandemic. So that's a huge chunk. So the patient doesn't have to travel to hospitals today. Most of the chronic discussions, most of the chronic diseases can be discussed and diagnosis done through consultations, right? So that's the power of sustainable solutions in healthcare. Okay, let me shift to something very interesting and very, very futuristic in healthcare, which is nanotechnology. I'm talking about, guys, nanomaterials. I'm talking about nanomaterials and nanodesigns, which are shaping the way we are doing diagnosis early and treatment early. I'm going to talk about something which is very interesting from a hospital's perspective. You might see hospitals in the near future having their own solar power plants, own windmills. So they are like sustainable infrastructure for the future. They're like sustainable infrastructure which are very, very resilient for the future. So that's the kind of hospitals which will get created as renewable energy. And this is work in progress as I talk, right? Okay, so to tackle what I just talked to you about, all the new innovations which are coming up in healthcare, to tackle these innovations and these opportunities, it's very important for the global workforce to come together. They have to collaborate, as well as there has to be a good exchange of knowledge so that everybody is empowered from a knowledge perspective, right? So I think this is a very critical element in the journey, which is global collaboration and knowledge sharing, which will take us to where we want to go in healthcare on a path of innovative solutions which are sustainable in the near future, right? So towards the closing, I would like to emphasize on a few very critical things, which are these innovative solutions which I talked to you all about today, are not only helping from an innovation perspective, they are not just jargons, but they're going to help you in decreasing the cost of healthcare. So the cost and the access is going to go up, the cost is going to go down with these medical devices. That's number one. The second thing is about these hospitals, which are going to be the future hospitals with renewable energy, right? The third one is, this is futuristic. This innovation, sustainability is futuristic, right? Because at the end of the day, both are in harmony with each other. So guys, join me in this journey of innovation with sustainable solutions in healthcare. I am very sure that we will write not only a small chapter inside the medical history, but I'm very sure that we will write the entire novel. So thank you so much for inviting me here, and I hope you enjoyed the talk. Thank you.